Good evening, everybody. My name is Ja, and I wanted to talk to you guys today about essential oils and using them for pregnancy, labor, and postpartum. So let's go ahead and jump right in. So let's first go over a little bit of background information about the different trimesters and the different things that women experience when they become pregnant. So the first trimester, the things that you usually experience are fatigue, nausea, breast tenderness, swelling, cramping, food aversion, dizziness, and constipation. These are all the different changes that are going on in your body, whether you know that you're pregnant or if you don't know that you're pregnant. Some of these changes start to take place, and sometimes for some women, it is how they find out that they're pregnant. You also start to experience mood swings, weepiness, crying, and even a little bit of anxiety about the new information that you probably found out about being pregnant. For your second trimester, some women tend to experience backache, stretch marks, and nutritional issues. During the second trimester, this is when the baby is growing. Therefore, your stomach is growing. You are experiencing skin changes. Your back is aching because you have all of the gravity being pulled to the front of your body. And this is when the baby starts to require more and more and more of the nutrition that you put in your body, thus leaching off of you, taking away from the mother. Let's move on into the third trimester. This is when pregnancy is about to turn into actual labor and you're nearing the end of your pregnancy. You experience muscle and ligament pain, sometimes restless sleep because this is just an uncomfortable situation for you. You have a whole human being growing inside of you, so therefore it's discomforting. You might experience some skin problems. As I mentioned in the second trimester, your nutrition is going to be really, really important in these two trimesters because that is when the baby requires much, much more from you as a mother. Some women have fluid retention. You see ankles getting swollen, feet getting swollen, mood swings, up and down, highs and lows, a busy brain at night. Some women are a little bit anxious because of what's about to take place. Their lives are about to change completely. So the joys of being pregnant now become, hey, I want this baby out. I'm uncomfortable. I'm a little nervous about what to expect afterwards. So some women even experience very vivid dreaming. Your hormones are at an all-time high, especially at the end of your pregnancy. And this can definitely cause the busy brain and the vivid dreaming. Okay, so let's go ahead and move on. Okay, so which oils can I use? So even if you are thinking about getting pregnant, sorry, these oils you can use prior to getting pregnant, during pregnancy, during labor, and after. So our essential oil heavy hitters are Elevation, Balance, Lavender, Geranium, Serenity, Citrus Bliss, Frankincense, Aroma Touch, Digestion, Peppermint, Deep Blue, and then a couple of ones that we threw in there at the end were Yarrow Palm and Copaiba. These have been noted to be the heavy hitters for women who are thinking about getting pregnant and who have become pregnant. And I'm going to go into explaining to you the benefits of most of the oils on this list. Okay, so let's start off with Balance and Elevation. Both Balance and Elevation are our mood oils. They promote a fantastic mood. They elevate your mood and they stabilize your mood. So Balance is going to ground you, give you a nice stable mood. Elevation is exactly what it sounds like. This is used to elevate your mood. So if you're experiencing mood swings and you're pretty sad or you're down or you're experiencing weepiness, you probably want to use Elevation. If you're feeling like just out of whack or your mood is just all over the place, you wanna probably use balance. Um, you can use both of these oils um, as a topical um, blend. You can put it in a rollerball. Make sure you dilute it heavily, being that you are experiencing this change of having a new life in your body. Your sensitivity to certain things might change as well. Um, your sensitivity when it comes to certain smells might change. Um, so both of these oils are most highly recommended um, to combat postpartum, prevention, and maintenance. So if you have become pregnant before and you know that you have experienced postpartum in the past, you probably want to get started with using these oils right away, whether or not you're experiencing any sort of mood symptoms. Okay, so you can use them aromatically and topically. You can dilute it with fractionated coconut oil, olive oil, any other carrier oil that you see fit. Um, and you're going to want to use those on your pulse points, so on your wrist, behind the ear, anywhere that you see fit. Putting it in a diffuser, having that diffuser going all the time would be very, very useful in this situation. Okay, let's go ahead and move on to lavender and serenity. Let's first start off with lavender. Lavender has a million uses. So even if you're not using it specifically for your pregnancy, you can find other things to double over and use lavender for the entire household. But lavender is great for a wide range of issues, including pain, swelling, fatigue, any sort of leg cramps or restlessness. Um, if you have a sensitive sense of smell during this time, it's actually also good for nausea. So the number one oil that we recommend for nausea during pregnancy is usually peppermint. Peppermint is a very powerful and invigorating scent. So some women actually may find that is overbearing. You can use lavender for any sort of nausea, any sort of headaches. You can massage it into legs for any sort of leg cramps. And any sort of swelling or fluid buildup in your feet. So during the first trimester, you can use this for the nausea and the headaches. You can also use this for any sort of sinus congestion, any sort of seasonal threats. A lot of pregnant women cannot take certain medications or different medicines. And the whole point of us using essential oils is so that we can learn to be medicine free and maybe even completely natural throughout the duration of your pregnancy. During your second and third trimester, it combats itchy skin and stretch marks. This has been used to prevent stretch marks. So immediately, once you find out that you're pregnant, you can actually start using lavender on your skin, on your belly right away. Along with the carrier oil, of course, want to make sure we dilute it. And any sort of itchy skin, our skin usually itches when it's stretching. But we also might experience some different skin sensitivities during pregnancy, things that you were not allergic to, you might become allergic to. Some of us just have very sensitive skin during that time. So you can use lavender aromatically in a diffuser or topically on your skin. So Serenity is a blend that actually includes lavender in it, and it's great calming blend. It's great for stress and anxiety, any of those moods that you're going through, any sort of mood swings that you're going through. You can also use Serenity. It helps to relieve headaches and promotes a restful night's sleep. So if you are somebody who does not sleep well after having become pregnant, Serenity would be a great option for you to use in your diffuser. You can also use that topically on your body, put it in a roller ball, and make sure you dilute heavily. Let's go ahead and move on to geranium and frankincense. So geranium is used, again, for a number of different things, but specifically speaking, when we're talking about pregnancy, it is used for hormone support. Okay, it is used for different muscle aches and pains, stretch marks, again, varicose veins, hemorrhoids. I have personally used the geranium diluted in a spray bottle with water and fractionated coconut oil for hemorrhoids, and I was not pregnant. So you can use these things whether you're pregnant and experiencing these symptoms or if you are not. It's great for hormone balancing. Use it topically or aromatically for the best benefits. Add it with frankincense, and it actually increases the effects or the benefits, if you will. So frankincense, as we know, is the king of all oils, and it can be used just about for everything. But in this specific instance, we're going to use it for calming relief. Some of us use frankincense for yoga because it has the same calming effect. So we want to use both of these oils for hormone support and mood balancing. It helps prevent stretch marks as well. So adding it with that geranium and a carrier oil would be beneficial to rubbing on your belly or anywhere that you could potentially experience skin stretching or stretch marks in general. It is helpful in healing tissues after labor. So your insides after labor are very, very sensitive. You can use frankincense to help speed up the healing process and help those tissues get back to normal as much as possible. Frankincense is great for emotional support and stress during labor. So the same way we mentioned using it for calming and stress relief, you can use that for stress relief during labor. It has been said that frankincense is a great oil to use to process trauma of any sort. But specifically speaking, when it comes to pregnancy, we can talk about miscarriage. So helping us understand and process the situation that had just happened, help us to not blame ourselves, help us to release, and just process that trauma that we're experiencing. So frankincense is also great for brain fog. Some of us call it brain fart. Some of us say we're spacey. There's a number of different things that you can say when it deals with brain fog. Brain fog is maybe just not remembering some things or just feeling like your memory or your thought process is a little bit clouded. It also helps control excessive bleeding. It helps the uterus constrict. So again, post-pregnancy and after labor, you want to go ahead and use frankincense to help get all of our to help us kind of bring our bodies back to perfect harmony, help get our uterus back to where it was prior to pregnancy. After birth, you can apply it to the crown of the head on the baby, on the baby's spine, and over the mom's heart. This is said to aid in bonding, helping the bonding between mother and baby. Okay, so using this topically and a neat massage and internally can be extremely, extremely beneficial. Deep Blue and Aroma Touch. So Deep Blue comes in an oil, it comes in a pill form, and it comes in a rub. Pictured here is the actual rub, and the rub is fantastic. I love the rub. I personally use it for some injuries that I've had before. I've used it before I go exercise because it just gives your muscles the oxygen that they need to not be sore after exercising or doing like an invigorating run or something of the sort. So that brings us to our first point, where it relieves aches and pains. They will come and you will love the relief. The main ingredient in Deep Blue is wintergreen. So it kind of has like a cooling feeling, almost like an icy hot or like a Bengay. The only difference is it's actually driving into your muscles and healing those sore or achy cells or even damaged cells to help repair them. So we're not putting a Band-Aid on our aches and pains. We're actually correcting those different aches and pains we're experiencing in our muscles. As you start to grow, as your belly starts to grow, there's more weight on your body, there's more pressure on your legs. Deep Blue and Aroma Touch are great oils to use to combat any sort of pain and aches. So you can use this before, during, and after pregnancy for muscle, joint pain, swollen feet, soreness, lower back soreness, all the aches and pains, they will come. They will come. So you can also use this for any sort of cramping, any sort of swelling, any sort of fluid retention. I put in parentheses that you can use it along with cypress because that oil is known to reduce fluid retention as well. Okay, so we really want to reduce any sort of inflammation, and both of these oils and or rub is good for that. Apply topically, make sure it is diluted, or blend in a balm. Okay, so you can create like a balm made out of shea butter, put a couple of drops of aroma touch in there, or you can just buy the deep blue rub exactly the way it is. It does have a pretty strong smell, the deep blue rub, because of the wintergreen. So if you are someone who is sensitive to the different smells, then aroma touch would probably be the best option for you as well. Digestin. This is my personal favorite oil. Digestin is what I say saved my life. It can be used for all types of digestive issues. It is a blend of a bunch of different oils that aid in helping digestive issues. It aids in helping constipation, overuse of the restroom, diarrhea, any sort of upset stomach, any sort of bloating, acid reflux, heartburn, gas, any sort of issue, any sort of digestive issue, you name it, digestin is your oil for that. Okay. So during pregnancy, you can use this topically, and it is even safe to use internally. Of course, I do have to mention that you should consult your doctor. We are not by any means going against any regimen or anything that your doctor has told you to do. But digestin, you can just use it right on your belly. You can rub it on your belly. And you will probably experience the benefits within about 20 seconds to 2 minutes. I use this anytime I have an upset stomach, if I ate something that's not agreeing with my stomach, if I have not used the restroom and I want to use the restroom. Digestion brings overall harmony to your digestive tract. Okay, so for pregnant women, nausea is common. Constipation is common. A lot of women are on prenatal vitamins. Prenatal vitamins tend to make you constipated in turn. So digestin is a great oil to have on hand for those purposes. Okay. So as I mentioned in the beginning, our nutrition starts to take a turn when we get pregnant and as we move into the second and third trimester, because the baby is leaching off of everything that the mom has. Okay, so that's why it's important to eat healthy before you become pregnant, but if nothing else during your pregnancy, because everything you eat goes straight to the baby. Every nutrient that you put in your body, not only is the baby taking that away from you, but you also need to replenish so that you have enough energy and nutrients in your body for yourself. Okay, so your body will give the baby the nutrients from your body first and leave you what's left. Some women experience the hair might start falling out, your skin might be dry and rashy, your skin might become over oily, your teeth may become loose, your gums might become sore. There's a whole range of different things that take place in our bodies when those babies are taking our nutrients from us. So our LLVs, our lifelong vitality supplements, are going to aid you perfectly before pregnancy, during pregnancy, and after pregnancy. So if you are somebody who doesn't necessarily want to take prenatal vitamins, or you're having an adverse effect to prenatal vitamins, the LLVs will give your body more than enough of what you need during pregnancy. So it provides you with vitamins and minerals, which are bioavailable and easily digestible. Some things that we lack during pregnancy are iron. We become vitamin C and vitamin D deficient. These vitamins have more than your daily recommended amount of nutrients to provide both you and the baby with the nutrients that you would find in any sort of prenatal vitamin supplement. Okay, Terrazyme is a supplement that aids in digestion and constipation. So Terrazyme is great if you are experiencing constipation during pregnancy or any sort of digestive issues during pregnancy. This will actually help to continue to break down the food that is in your body so that you are not experiencing any sort of digestive issues. And PB Assist. PB Assist is a great immune boosting supplement. It builds your immune system while you're pregnant. Our immune system also takes a hit when we're pregnant because, again, we're giving the baby the first bit of whatever we're going to have in our body nutrient wise, and then leaves us with whatever is diminished or left. It helps also with constipation, and it actually contributes to good bacteria in our gut. So if you are having nutritional issues, some women cannot hold food down. Some women have trouble eating certain things, things that you were once able to eat. Now you can't necessarily eat them. Our bodies change in that sort of way when we get pregnant. The PB Assist actually adds good bacteria into our body to combat different yeast that prevents yeast from growing, which can also lead to yeast infections. Some women think just because they're pregnant, they can't get yeast infections. Well, your body is overproducing everything. So it is also overproducing yeast, the bad yeast. Okay, so taking your supplements on a regular basis and taking PB Assist on a regular basis can actually combat the bad yeast from forming. Okay, let's go ahead and move into labor. Oils during labor, such as clary sage, citrus bliss, and peppermint, and heliochrysum are going to be our top oils to use during labor. And of course, we remember from before that frankincense, the king of all oils, is great as well. So clary sage helps to improve effectiveness of contractions. So you want to apply clary sage with a carrier oil weeks before you go into labor. It will help the contractions speed along. It will lessen the intensity of the contractions. And if you use it with frankincense, it is that much more powerful. Clary sage is also an oil that you can use much before you even decide to get pregnant, because it is a great hormone balancing oil, and you can use it after as well. Some women experience contractions even after birth, and clary sage is great in that area. Citrus bliss and peppermint, using those together is just phenomenal. If you've ever been to an essential oils class, you probably were given citrus bliss and peppermint together because it boosts energy. Okay, it gives you tons of energy. It's great for a foot massage. It feels invigorating. Make sure you dilute and make sure you use it sparingly, specifically speaking because of the peppermint. Peppermint is very strong smelling, and if you have any sort of sensitivities to smells, then peppermint is definitely, peppermint definitely needs to be used a little less. So any pregnant person wants to use the oils from 1 to 2 drops and then increase depending depending on how they feel. You never want to do too much and then lower the amount of drops that you're using. You want to go the opposite way. You want to see how your body is responding to the oils and then increase on a need basis. Last but not least is heliochrysum. So you want to apply a heliochrysum over the belly to help the uterus shrink back down and control bleeding. Okay, so there will be lots of bleeding after, during and after labor, and applying heliochrysum with a carrier oil over the uterus and over the pelvis helps the uterus to shrink back to its regular size and control the bleeding. Okay. There is a period of time where you can't exercise and all these things after pregnancy, but the way that we can go ahead and help our internal organs get back to the way they felt before pregnancy are to use some of these oils, and I'd probably throw in frankincense in there as well. Okay, so oils after labor or during postpartum that you want to use are clary sage, which is the oil that we just spoke about, clary calm, which is a blend that includes clary sage. It is a women's blend, balance, and elevation. Okay, all of these oils are going to promote emotional and hormone support. So you just went through a whole 9 months of being pregnant, having a baby inside your body, and now the baby is here. There are going to be a lot of emotional moments and a lot of hormone changes once again. So your body just went through changing hormonally for 9 months, but now your body is going to be changing hormonally, maybe indefinitely. I mean, we as women, we go through hormonal changes pretty much until we go through menopause and even after. But having that hormone support is extremely, extremely important to get our bodies back in complete harmony and total balance. Um, our aromatherapy system are 6 different blends that are targeted specifically for emotional support. So if you are somebody who feels like you would benefit from the emotional support, then definitely want to try that aromatherapy system or that aromatherapy kit that we have. Heliocrysum, myrrh, and clary sage can be applied over the entire belly, as we mentioned before, to continue to shrink the uterus, to help promote tissue healing, and again, to reduce or even stop the bleeding. Okay, lavender, frankincense, and immortelle are great for skin irritations, any sort of itches. As we mentioned before, lavender, of course, that's our first go-to. We want to go ahead and layer and add frankincense to that if we're having really severe skin itching or any sort of severe irritation. And immortelle is a great oil for any sort of skin issues. If you're experiencing blemishes on your face during pregnancy, using these oils, maybe with a shea butter, some sort of salve, or some sort of um, carrier oil would be beneficial as well. Okay. I decided to put in a padsicle recipe because it is super cool. And when you go to the doctor or the hospital, they're actually going to give you these cooling pads. So after you have the baby, you are going to be experiencing a lot of changes, a lot of vaginal changes. Okay. This recipe is great for 10 pads. Okay, there's a suggestion of a brand to use. The reason why is because I'm not sure if you know, I just found this out. A lot of pads are made with plastics, which is concerning to me. So we don't want to use this recipe on plastics because plastics are biodegradable, and we want to use the pads in the most natural way possible. So you want to use a half a cup of witch hazel, half a cup of water. Pictured here, you actually see that a lot of the recipes suggest using aloe vera. So aloe vera gel, I would probably throw in there versus the water. The water might make your pad really, really soluble and soaked up, whereas the aloe vera gel is just a jelly, and it'll kind of sit on the pad, and it'll absorb just a small bit to the pad. So you want to pour this mixture, about 2 to 3 tablespoons on each pad. Put 1 to 2 drops of frankincense, lavender, and heliocrysum on each. You want to stick flat and pack into a Ziploc bag. You can layer them, just put them on top of each other, and you want to freeze them until you're ready to use them. And then this is something that you want to go ahead and throw in your hospital bag. Or if you are not going to the hospital, then you definitely just want to have these on hand. This is great for healing the perineum after having a baby. It reduces bleeding, and it helps damaged tissues. So like before, we mentioned frankincense and heliocrysum are great for healing damaged tissues. There will be tissues damaged whether or not you feel it during pregnancy, and this is a recipe that you can do well before you have the baby, and it won't spoil or go bad. You can go ahead and get this started. If you're getting anxious about pregnancy, about labor, then go ahead and start being creative. Start to create some of these little recipes so that you can get your mind off of the entire process of labor and what to expect. Okay. So safety and pregnancy while using essential oils. You are going to want to make sure you dilute. You will not lose the effectiveness of each oil just because you decided to dilute it. Okay. Diluting is the safest bet for somebody experiencing such changes, such as a pregnant woman, and for newborns. Okay. So diluting with any one of your favorite carrier oils, grapeseed oil, fractionated coconut, olive oil. There are tons of other carrier oils, but you can use whatever carrier oil you prefer. Another safety tip is to know your body. As I mentioned before, you want to start off slow and gradually increase. If you know that you were sensitive to smells and different things before you got pregnant, chances are you might be sensitive to certain things during pregnancy or even after pregnancy. Okay? Consider your overall health and risk level. This basically just means just knowing yourself. Okay, so if you were a skeptic before using oils during pregnancy, when you become pregnant, you're probably still going to be a skeptic of using oils. So we don't want to have anybody feeling like oils contributed to anything or took away from anything during pregnancy. That's why it is a huge suggestion that you begin using oils before you become pregnant. Familiarize yourself with the oils so that you're comfortable using the oils. Okay. And don't panic. Don't read a whole bunch of different blogs and posts and Pinterest that scare a lot of people into not using essential oils altogether, whether pregnant or not. There are a lot of myths out there that you will come across that tell you that essential oils are not safe for pregnant women. Their main reason for the disclaimer that a lot of things aren't safe are because there's just not a lot of testing out there. A lot of pregnant women have not undergone tests, even for pharmaceuticals, which is why certain medicines are just banned from being used by pregnant women. It's not because we tested all these pregnant women and something bad happened. It's actually the opposite. We haven't tested enough, and we're not quite sure what the risk factors are. So to be on the safe side, we just say, pregnant women, just eliminate using a lot of different things, okay? A great book, or rather a great, it is, I believe it's on the internet. It is written by Stephanie Fritz, who is a midwife, and she wrote Essential Oils for Pregnancy, Birth, and Babies. It is a fantastic, it's like an ebook. It's very, very short, to the point. But if you are somebody who wants to get some information from a source that is very credible, and somebody who is practicing as a midwife and using the oils while doing it, Stephanie Fritz is a great resource to have. Okay. So that pretty much concludes essential oils, pregnancy, labor, and postpartum. I hope that you enjoyed this webinar or this audio. And hopefully, if you're thinking about becoming pregnant, even if you're not thinking about it right now, even if it's in the close near future, such as myself, I've already started to familiarize myself with the whole process. And started using all of the oils. Use the LLVs. Get your body ready. If you want to get your body a nice jump start, or even do like a cleanse on your body, you can do that naturally with oils. If you want to detoxify before getting pregnant, if you want to increase your libido before you get pregnant, there are oils for that. So definitely reach out to any one of your wellness advocates if you have questions, concerns, if you are thinking about becoming pregnant or have become pregnant and you just want to take take some of these things that you've learned today and apply it to your routine, feel free to reach out. Otherwise, I hope you all enjoyed and have a great day.